Assalamu alaikum wa rahmatullahi wa barakatuh, and good evening to all the listeners and viewers this evening. Once again, you are tuned into the airwaves of Salam Media and coming to you on the various platforms of Salam Media. It is Wednesday nights with myself, Inayat Wadi, this evening with you. The time is just gone 5 minutes past 7 p.m. Central African time as we welcome you to the show. We welcome the viewers on the YouTube channel, also on the Facebook channel, and the various platforms of Salam Media this evening. Now, tonight, we are looking forward to a very interesting discussion because we've heard the announcement come through from the President of South Africa about the intention to introduce what is termed a vaccine passport. Now, we know at this point in time there is widespread mistrust with regard to the COVID-19 vaccine. And obviously, the idea of a vaccine passport or the intention of a vaccine passport has now created a further discussion, further debate. And just to understand and to ask a question this evening, are COVID-19 vaccine passports fair? We are joined by our panelists this evening from now right until 8 p.m. We have got joining us out of Cosatu, we've got Matthew Parks, and we also have got Professor Ames Dhai, Professor leading authority in bioethics. Firstly, Professor Dhai, good evening to you and welcome to the show.
Thank you.
Yes, and also to you, Matthews, welcome to the show. Wonderful that you're able to join us.
Good evening. Thank you for having me.
Yes. Now, Professor Dai, just to start off with, and the whole question surrounding ethics. Now, we know vaccine, whether to vaccinate, not to vaccinate, has been a major talking point in the country. And just looking at now an added dimension to the vaccine debate that is taking place, not only in South Africa, but right across the entire world. And the announcement that came through from the president obviously has created this discussion. There are definite concerns. Now, let's just look at it from an ethical perspective, looking at vaccine passports and how that would actually measure to what we would term as ethics.
So, yes, I do agree with you that there's been quite a huge concern with regard to the announcement. And I think this could have been averted had there been proper communication from our leadership as early as last year when the vaccines were actually being considered and discussed. And I think at that stage, if there was information on what the vaccine is, why we need the vaccine, and how we would take processes going forward, then I don't think we would be at this stage of contestation with regard to whether or not we should be taking the vaccine. So I do believe that the leadership in the country did do South Africa a disservice. Now, in terms of ethics, if we're going to be considering taking the vaccine, I think we need to look at it as not, I am taking the vaccine for me only, but I think we need to bring in our African traditional values of interrelatedness, interconnectedness, as promulgated by the Ubuntu principles. And, we need to then, once we take this in, we can actually make an ethical argument that the vaccine, the COVID-19 vaccine, basically would be for the health of the nation. And what do I mean by the health of the nation? It's not only medical health, but we're looking at economic health, social health, etc. And we see how we have suffered through, in terms of various aspects during COVID-19. And we also see what the many lockdowns have done, not only to medical health, but to the economy of the country. So taking the COVID-19 vaccine from the medical perspective and from the perspective of the health of the nation, I think is something that can be ethically justified.
Yes. Now, Matthews, as Professor Dhai has just mentioned, the buck obviously stopped at the top. And when one looks at the entire vaccine debacle that has been a talking point for a very, very long time, since the time the vaccines were basically rolled out. And we know, as Professor Dhai mentioned, leadership. And it does appear that we have got a leadership problem because every time an announcement is made, somehow we seem to be caught by surprise. And this, in the case of this latest announcement with regard to the intended vaccine passports.
Yeah, look, I mean, I think to be fair to the government and to the president, we're all feeling in the dark. None of us have ever managed a pandemic before. And this is not just a South African challenge, it's a global challenge. It's caused huge amounts of lives, at least 85,000 South Africans, possibly much larger than that, have passed away. Has put us into the deepest economic recession in 100 years. So I think what's critical is for all of us to work together to find solutions to manage it, to save lives, to save livelihoods, so we can emerge in the pandemic safely. I think we're very lucky to have a vaccine being developed so quickly. It's far better to have it now than to be waiting 5, 10 years for a vaccine to be developed, and at the cost of much more lives and a cost of a much greater economic hardship, etc., and job losses. I think what we're keen on as Cosatu is to see how can we assist, how can all of us work together, be it government, business, trade unions, civil society, the religious sector, the media fraternity, to make the vaccine rollout campaign a success, because our lives, our jobs literally depend upon it. I think it was a huge disaster, as you said in the beginning. It took us about 6 months to get the vaccines here in sufficient numbers. And every time there seemed to be another obstacle along the route, whether it was expired vaccines we received from India, whether it was the vaccines which are not sufficiently resistant to our local variant, etc. But having said that, I think there has been a significant turnaround in the last 2 months, 3 months. We now have sufficient vaccines on supply and en route. Currently, we have about 5 million vaccines in our depots right now. That can cover us for more than a month. I think we've seen a sufficient increase in the daily vaccination rate to about 200,000 Monday to Friday on a daily basis and about 70,000 on a weekend. I think for us, is more concerning is that we're not getting vaccines out to people fast enough. We should be actually vaccinating about 400,000 people a day if we're going to achieve that 70% plus population immunity level, which is so critical by the end of this year, so we can save lives, get the economy moving again, etc. So I think for us, it's really about how can we mobilize society to understand why the vaccine is critical, how it will help save people's lives, protect their families, enable people to go to work safely, etc. And the dangers of not vaccinating. We do appreciate we live in a democracy where we have a diversion of viewpoints. I think it's been quite clear right now with the amount of people who are hesitant on the vaccine. So I think we need to, and we support Cosatu, an educational route to convince people why it's important to vaccinate, how it's safe, how it's going to benefit them. We wouldn't support a coercive route, which is going to force people, because that's not really going to be sustainable. It's been very difficult to force people physically to vaccinate. So we need to look at an educational way and a partnership way. We're keen to work with our colleagues in business and in government about how can we mobilize society at large, how we can bring the vaccines to people, to the communities, to churches, to farms, to workplaces, etc. But also how can we address people's concerns? And look, I think maybe lastly that this is not the first time we're having to deal with a vaccine. When your children are born, we vaccinate them for a variety of diseases, which were once pandemics: measles, mumps, polio, etc., cholera, and so on. When we take our children to schools, they're required to provide the vaccine certificates, the clinic cards. And when you travel to other parts of Africa, to yellow fever zones, you're required to have a yellow fever vaccine certificate. I think, to be honest with you, this is likely to become a new normal. I think we're likely to require or to need for our own health vaccines probably twice a year for the next 5 years till this pandemic really gets under control, if you look at international historical trends. But I think for us, really what's critical is that we work on this journey together, we address people's concerns, and we do so in an inclusive and a democratic way. And I think that's the most sustainable way to do it. I think forcing people is going to backfire. We're a constitutional democracy, we're not a police state. So we do need to get the right balance, and really convincing people is the right approach to take on this kind of an issue.
Yes, thank you for that, Matthew. Now, Professor Dhai, we accept the fact that COVID has changed our lives, and it's going to change our lives for a long, long time to come until we get to a normal situation. And I'm not too sure whether in the short term we will actually achieve, getting into the normal state. But the key issue here at the end of the day is, as Matthew had said, that, it's basically the pandemic had caught everybody off guard, and it's been difficult to be adequately prepared to take into account every eventuality along the way. So it's basically been a learning curve. There's been trial, there's been error as well. But at the end of the day, the key issue here is looking at regulation, looking at, as Matthew mentioned, that we are a constitutional democracy, and looking at this vaccine passport. Now, we've seen other countries obviously talking about vaccine passports. We've seen Britain, for instance, that's saying that now that they've reached normality, they will reconsider or possibly even scrap what is termed the vaccine passport. Now, looking at us in South Africa, we're in an infancy stage. We haven't even got to herd immunity or population immunity as far as vaccinations are concerned. Should we be talking about vaccine passports right now?
I I think we should be talking about vaccine passports, and I think the conversation on vaccine passports should emphasize choice. So one would have that choice in terms of whether one is going to carry the passport or not. And and I think society must make informed decisions. I disagree that we've been caught off guard. I do believe that we've had 18 months, and from December last year, we've been talking vaccination, or even before December last year. So we really, really needed that educational communication from our leadership, and that needed to filter to the ground. And that, unfortunately, has been very slow. And I would say this is one of the reasons that we are in a situation that we are today. When people refuse to take the vaccine, are they making an informed choice? Or are they making an uninformed refusal? So when you look at the science behind it all and the studies that have come through, the surveys on vaccine hesitancy, what one sees is that the greatest, some of the greatest reasons, or the reasons often quoted for not taking the vaccine, is the fear of the side effects, the fear of what the components of the vaccine are, and the fear of what the vaccine is going to do to you long term, 2 years down the line, etc. And this is the information that actually needed to get out to our people, our South African population, even before we started the rollout. And there was time during the phase 1 rollout, which was basically the Sisonke program for healthcare workers. And there was time during that stage to ensure adequate information sharing with people on the ground. And I believe that meaningful community engagement is so necessary. It legitimizes the processes. It actually, trust and truth telling is so important. When it legitimizes the process, it in a way gets our population to start trusting our leadership. And at this moment in time, we do know that the trust in our leadership is rock bottom. Not only because of vaccines, but I think we need to look at this in our entire context, the Zondo Commission, etc. And of course, the pandemic periphery that has been ongoing. So South African society is quite unhappy with what they see. And it is therefore not surprising that they distrust leadership, and with that comes a distrust of vaccines. What do we have to do? What would our responsibilities be? For those of us that are in the know-how, I think as responsible South African citizens, it's important to share the correct messaging. And I'm really glad that Matthew brought up the educational aspects that Cosatu is discussing, and partnerships with private sector, etc. I'm also so glad that you have decided to host a program like this, because when you look at our South African society, we're not one homogeneous society. There's such multicultural diversity with different religious beliefs as well. And it's important that we need to realize that messaging does not, if you have a one capsize fits all, doesn't work here. And we've got to have different sectors of society actually contributing to the positive messaging to build up vaccine confidence, so we can start moving towards some semblance of normality. I do hear the issues around us being a constitutional democracy. I think that's very important to take into consideration. And currently, the vibe out there is, well, it's our constitutional right not to take the vaccine. And there's Section 12 in terms of the right to bodily integrity is quoted, and Section 15, which is the right to religious belief and opinion. And we understand that, but I think as part of the educational process, we need to get our South African society aware of the fact that most rights are limited. And those rights will be limited based on the importance of the purpose of the right, and whether it's the least restrictive way to actually achieve the ends that we are trying to get to. And, when you look at the purpose of limiting such a right, what would that purpose be? It would be that public health need, to secure protection against death and severe disease, to decrease onward transmission, to reduce the risk of ongoing mutations into variants of concern. And it is scientifically proven that where vaccine programs are slow, you have a poor coverage, and where you have an immunocompromised population. And in South Africa, besides our HIV positivity rate and untreated individuals, we do have immunocompromise for various reasons as well. And, we did come up with a variant. We produced the beta variant in South Africa. We need to protect against all this. We need to relieve the pressure on our ICUs, the pressure on our healthcare workers who have been at it 18 months non-stop, and the pressure in terms of all of us not being able to receive general necessary healthcare, because most healthcare has been diverted towards COVID-19. And every time we go into a wave, there's very little of any other healthcare available. In terms of this being the least restrictive, I think it is the least restrictive because we've had masking, we've had social distancing, and we've had hand washing, etc. But we haven't been able to keep the pressure off the hospitals. We haven't been able to keep the number of deaths down, and we haven't been able to assist and relieve our healthcare workers. And because of all that, we can see how our economy has suffered. We've gone from one lockdown to the other. And so vaccines, I would say, would be the least restrictive way of actually achieving this purpose that we'd like to achieve.
Thank you for that, Professor Dhai. Now, Matthews, looking at vaccine passports now, obviously we've got a number of countries that are way ahead of South Africa in terms of their vaccine rollout, and it is clear that there is a lot that we can actually take from what these countries are doing, what they have achieved. We see what is taking place in Europe. We've seen even recently with massive sports events where we see stadiums that have been packed to capacity. We don't see any masking. Now, it is clear that a majority of their populations have already been vaccinated, and that is the reason why they can take those decisions. That is why they can ease the type of restrictions. And when we talking about vaccine passports, generally, I think many of us are thinking about travel. But when one looks at what Europe is doing at this point in time, we see a number of countries that are still considering vaccine passports. Certain countries have committed to implementation. Looking at Israel, for instance, now Israel seems to be ahead of the pack, where a large part or large a portion of their population have been vaccinated. They're talking about green passes, talking about restrictive sites, and not only travel. We're talking about hotels, we're talking about gyms, we're talking about restaurants, we're talking about the workplace as well. And this is where I think looking at it from Cosatu's perspective as well, where we look at a large working population, when we talk about vaccine passports, will they be allowed to go to work? Do they need to be vaccinated or not vaccinated to be able to work in the workplace? Now, these are some critical considerations that one needs to take into account.
Yes, no, look, and I think for all of us, this is a learning experience. I'm sure 2 years ago, we would have never imagined that our daily lives would be turned upside down like this. I think Professor Dhai made a fantastic point as she concluded when she said the vaccine actually is the least intrusive intervention and one of the most effective ones, compared to the masks, total lockdown of an economy, a curfew, shutting parts of the economy. There are, as you said, useful international examples to learn from Europe, from Israel, from the US, from China, etc. But what to do, what not to do. I think it's a very delicate thing. People are emotional, social creatures by nature. We've also seen, unfortunately, some counteraction to some of the vaccine certificate ideas, like in France, where people protested against the idea of a vaccine certificate to go to a restaurant. So we need to find the right balance. But I think, look, as Professor Dhai said, the most powerful weapon is actually to convince people. If someone is convinced, then it's not a problem. You don't need to police them, to bully them, etc. I think government needs to do a better job of communicating the benefits of vaccinations, how it's had a massive impact upon saving lives, lowering infections amongst those who've received it. Even those who got the vaccine still got sick, but they didn't get seriously sick in most cases. They didn't wind up in a hospital on oxygen or passing away sadly. It's a delicate thing. I think we're also having some engagements, and I think that's why the president could only say there's discussions taking place, not a firm decision, because there are many issues you have to consider. One is the security of a vaccine certificate, and that's the route we're going to go. Because in South Africa, we've got huge problems of corruption and fraud. There's an article today, just I saw on the news, where some Discam employees were suspended for producing fake vaccine certificates, receipts that the cards were getting. So it already shows you the propensity. We're going to have a problem there. What you really want is people to vaccinate, not to come with fake certificates and so forth. If you have a vaccine certificate, how will it be accessible to someone in a deep rural area of the Northern Cape who doesn't have a smartphone or the access to those technologies? But a piece of paper we've seen is not going to be sufficiently secure enough. I think it's likely that internationally, when you travel to Europe or wherever, you're going to be required to have a vaccine certificate, just like you do with a yellow fever certificate. But I have heard from colleagues who were in Europe recently how they weren't accepting our vaccine card. So there's a need for a smarter digital card. But again, how will it be accessible to the ordinary person? We must make the distinction, though, which is a very sensitive issue for workers. Going to work is a fundamental right. You have to go to work to survive, to feed your family, etc. We have to also bear in mind that medicine in South Africa is a consensual relationship between you and the doctor. If you have cancer, you have the right to decline chemotherapy. It's against your interest. You should take it, but no one is going to force you. Same thing if you're HIV positive. You have the right to not take ARVs, even though it's against your own interest. Of course, the pandemic is slightly different because cancer is not a communicable disease. You can't spread it by being in the same room with somebody else, etc. Whereas COVID-19 is a communicable disease, it's a pandemic, etc. wide interest as well. This is not just about the individual. Look, we've also been having discussions that you have, sectors of the economy which can't operate right now, like the sports industry, bars, clubs, the theaters, events industry, music, concerts, etc. They've offered that let them slowly emerge under trial basis with small numbers, social distancing, screening masks, etc., but also for people who have been vaccinated. And the interesting part about that idea, and there's pros and cons to it, obviously, is that going to watch the Springboks at a rugby game is not a fundamental right. It's not a necessity. You can watch it on TV as compared to going to work, for example, going to the supermarket or going to home affairs, etc. But it could be a useful way to incentivize people willingly to go and get vaccinated because South Africans, they love rugby, they love soccer, they love cricket. There might be a useful way to incentivize people. So you reward them for doing it. You show them the positive benefits to it. You help save these jobs, as opposed to a punitive approach where you say, if you don't get vaccinated, you can't go to work. And it actually might help lastly to actually resolve the workplace tension, because if you get everybody who loves rugby and soccer to go and vaccinate, you'll increase the vaccination numbers to such an extent it can achieve the same objective, but in a less coercive police state type approach, a more inclusive, positive reinforcement approach.
Yes, thank you for that, Matthew. We're going to go for a quick break. We'll be back in a minute or two.
Salam Media. Humanity sets the agenda.
Reliable access to clean water could save thousands of lives each day. With proper sanitation and easy access to fresh, clean water, communities can flourish. Our Thirst Relief Appeal provides clean water to communities in Asia, Africa, and the Middle East by building deep wells and providing sustainable water and hygiene solutions. A monthly donation of as little as 700 Rand could build a well for a community in need. That's only 23 Rand a day. Donate today. www.pennyappeal.org.za or call 031 11 00 573. Penny Appeal. Small change, big difference.
What makes Randery Jewels the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randery Jewellers, we know just how to make your special moments last forever. Whether it's for a wedding, anniversary, or just a simple gift to show your love, trust Randery Jewellers to make it special. www.randeryjewellers.com. Make your moments last forever with Randery Jewellers, the family name you can trust.
The following political party advertisement has been paid for by the party concerned.
Assalamu alaikum wa rahmatullahi wa barakatuh. Peace and blessings be upon all. My name is Imran Musa from the Al Jamaa Party. I am currently a councillor for Ward 9 in Lenasia. Vote Al Jamaa in the coming local elections for us to continue to serve you to the best of our ability. You must have seen the huge impact and felt the difference we are already making in the community. As your beloved councillor Imran Musa of Lenasia, you're most welcome to contact me on 082-805-1368 for any service delivery queries. # I love Lenasia.
Listen to something fresh. Listen to Salam.
Time is just gone 7:34 p.m. and the first part of tonight's discussion, or the first hour until 8 p.m., we are joined by Matthew Parks, Cosatu, and also Professor Ames Dhai, a leading authority on bioethics. And we are begging the question, are COVID-19 vaccine passports fair? Now, to continue with the panel, Professor Dhai, the key issue here is, and as Matthew mentioned, is the capacity to deal with some of these issues and these matters, and raising some very, very important issues, some critical issues with regard to whether we have the capacity to police things like vaccine passports. And also, we talk about Europe, we talk about the United States of America, but again, we cannot compare the two. We are South Africa, unfortunately, and there are a number of issues. Matthew spoke about the rural areas in terms of reaching out to the people living in those parts around the country as well. So clearly, there are challenges. And in your mind, just to understand would some of those challenges be with regards to vaccine passports and how they would be received in the country, or how they would be welcomed by the people in this country?
You raise a very important point, both you and Matthew, in terms of inequitable access, and especially in our remote rural areas. So, for as long as we have the really disadvantaged not having access to the vaccine because of the social issues, would we be able to say that the vaccine instituting the passport is fair? And I think that we would have huge concerns in justifying the fairness of such if all things are not equal. So there is a lot of work that has to be done, and it's got to be done as a matter of urgency. So we need to ensure that when we have the institute, the vaccine certificate, and I want to make a distinction because, there's going to be confusion if we use the passport terminology only, because very much of it is linked with international travel. And in some discussions, there have been concerns about using the term pass because of the sensitivities raised with our human rights abuses in the past, where people were forced to carry DOM passes. So, the first thing we need to get right is the terminology used for such a document. And I think perhaps we could refer to vaccine certificates for access locally to certain venues and sites, and we could use the term passport for the international travel bit. So in terms of the vaccine certificate, we need to be very, very careful that we don't increase the disparities that we already have. And, we don't, and this doesn't result in social harms, because we may end up with a situation where those that have access would have access to the certificates, and therefore get into certain areas or even into shopping malls, etc. Whereas those who, because they don't have the agency for the access, don't manage to get into the certificate, don't manage to get the certificate, and therefore they could be unfairly discriminated against. So that is something we have to be very careful about. The other important thing in terms of concerns that could come forward is, what would the individual who has got the certificate perceive it as? Would that individual think that he or she is totally protected against having COVID-19 or getting the virus, and totally protected against preventing it from spreading the virus? And as we can see from the vaccines that we have, the vaccines decrease onward transmission. They don't prevent onward transmission. And this is something that society will need to understand. Because I've had a vaccine, it doesn't mean I can get rid of all the other non-pharmaceutical measures like masking, etc. Because there is a possibility that I can spread the vaccine. I can spread the virus. Although if I spread the virus, to someone else who has had the vaccine, the virus, its effects will be very mild. It would be like a sniffles or having a flu, etc. But what will that do? If you have the vaccine and you get the virus, what is that going to do? It's going to interfere with the workforce, because if you do have the virus, you've got to go into isolation for at least 10 days. And if you go into isolation, then obviously you lost in terms of the workforce. And if the virus is spread to, assuming one is a patient who's not vaccinated, refuses to go for vaccination, and healthcare workers get affected, although they won't have severe disease and die, we're going to have a drain on the healthcare workforce. And this is going to be terrible if we go into a fourth wave and we don't have the adequate supply, so you have the absenteeism. So the misunderstanding of what the protections are in terms of the vaccine, for me, is critical. People need to understand what the implications of having a vaccine are and what the implications of carrying a passport are as well.
Yes, and Matthew, just looking at South Africa now, obviously, South Africa, we come from a very, very strong social background, and we are social animals in this country. We interact a lot, whether it's with families, it's societies, it's communities. And the key issue here is looking at civil liberties as well in this country. We've heard, and some of these cases have been horrific, where we've heard where families are saying, if you haven't been vaccinated, don't come to my house, don't come and visit me. Now, with a vaccine passport again, and this is a concern from a civil liberty perspective in terms of it being discriminatory against those who have not vaccinated or who don't hold vaccine passports or certification of any type, whether it's going to be a digital certificate or whatever it is at the end of the day. And I think this is where the big concern is in terms of civil liberties in this country, where we know we've come from a history in the apartheid era where civil liberties were obviously a major issue, and many people's civil liberties obviously were taken away. Now, this obviously adds another dynamic to what we to civil liberties, and whether people obviously will suffer or the consequences as a result of a move such as a vaccine passport.
Yeah, I mean, look, I think the question is getting about the right balance. All rights are protected for in the Constitution, for example, in the Bill of Rights. They're sacrosanct in many regards, but also rights are not unlimited. They come with limitations. They come with responsibilities too as well. So yes, individuals got the right. Medicine is always a consensual relationship between the patient and the healthcare institutions. But also here we're dealing with not just individuals' own personal constitutional rights, but the rights of society. How do you protect society? Because this pandemic is a communicable disease. It transmits from one person to the other person merely by being in the same room, by breathing the same air, etc. So we have to get the right balance. So I think for us, it's a difficult one. There are contradictions. There's no easy solution, to be honest with you. All the options have limitations. If you simply say, well, people, to each their own, sure, we may not ever achieve the 70% population immunity level, and we'll see people dying all the time. We were losing about 300, possibly 500 people every single day to the pandemic. Last year, 2.2 million jobs were lost because of the lockdown. Many more jobs may still be lost. Many workers have lost wages. Many industries of the economy are hanging by a thread and can collapse in a few months if we don't get this pandemic under control. So we need to balance that. We've had reports of workers in the mining industry who have been vaccinated, have really embraced the vaccination, have got huge vaccination numbers, and they work in very confined environments. 30 mine workers in a lift going 2 kilometers underground, limited air circulation, etc. They've refused to work with colleagues who are not vaccinated out of fear for themselves. And Professor Dhai is right. You may have the vaccine, but you still have a small chance of getting infected as well. So that's why it's so critical that all of us do it to ensure there's protection across the board. So we're going to have to find the right balance. We've had also cases where employers have wanted to dismiss workers who haven't been vaccinated yet, etc. We think that's not a healthy way to go about it. The better way is simply for the employer to engage with those workers. Why it's critical for family members to engage with their family members to say why it's critical to protect your grandparents who've got very low immunity systems because of the age and the comorbidities, that the grandchildren, the children, adult children, obviously, vaccinate to protect their grandparents. It's also critical that husbands and men have the lowest vaccination rate. Think beyond just the only irritation about a vaccine, but say if I don't get vaccinated, am I not putting my spouse, my children, my relatives at risk? So I think we need to look really beyond the individual and look at the interests of the families, of the economies, of colleagues, and to do what's best for them. We all make sacrifices. To be honest with you, this is not a big sacrifice. Government is paying for the vaccine with the support of the medical aid industry as well. The vaccines cost about 800 Rand each. Government has made the logistics easy. I went and did my second vaccination at a Athens Stadium, which is 500 meters from my house. They're now mobilizing mobile vaccine units to go into the heart of communities. So I think we should be looking how can we assist government, not to please government, but protect ourselves, to make sure we can continue to work. Because also when workplaces shut down because of an outbreak of an infection, it has a huge disruption to their workplace. It means often those workers will lose wages. If a restaurant closes, those waitresses go home with no pay. That's the nature of the restaurant industry. If farms close, those workers will go home with no pay, etc. So we do need to look at what are we doing to help society, not merely ourselves as individuals.
Well, certainly, and I think also, Professor Dhai, just moving forward and looking at some of the key considerations now that we've had this discussion, and I know many people are having exactly the same discussion that we are having tonight, and looking at some of the issues that the government need to seriously consider moving forward. We've heard now, comes December, we're talking of another wave as well. But again, from now until that wave hits us again, there's a lot that we can do. And like you say, we've had a long time. We've had 18 months now, and I'm sure that has given us sufficient time to make sure that we are adequately prepared, even in terms of tackling the next wave, but also more importantly in terms of the vaccination drive. And if we are going that vaccine certification or passport route, we've got sufficient time to make sure that we've got all our bases covered.
So that's a difficult one because there's an urgency. And, how do we get the vaccines into as many arms as possible? At the same time, we ensure that we develop agency to allow people to make an informed choice. So it's really very difficult. So because government hasn't managed thus far, I think partnerships with different organizations, we can see Matthew has spoken about partnering with Cosatu and with the unions, partnering with religious organizations, partnering with civil society, building trust in this way. I don't know if it can be done quickly, but they've got to try. There's got to be that urgency instilled into our populations as well, in terms of the need to take the vaccine, and there's got to be urgent movement from government as well. I think people need to realize no one's having their choice taken away from them. They're still making choices. But their choices, they will have to live with the results of their choices. So if they choose not to vaccinate, they need to understand they have a right not to have a vaccine, but that they do not have a right to infect someone else. That is something that they need to understand. And the messaging must be in simple language like this. And if they choose not to vaccinate and they've made informed choices, then what they need to do is they need to take responsibility for those choices. and they need to live with the so-called repercussions of those choices. So if they make informed choices in terms of not taking the vaccine, so they don't get a vaccine certificate, then they're going to be left out of restaurants, etc. They may actually be left out of the workplace. Look, I think, in terms of the workplace, this is complex, and in terms of taking the vaccine or the need to vaccinate will also depend on the operational requirements of the workplace. For example, and I can refer to healthcare because that's my background. In terms of healthcare, there's no such thing as, your employer can adjust the situation and give you a desktop job or say to you, work from home. You're required to be on the ground and you're required to be frontline with the patients. And in terms of that situation, and yes, there are some healthcare workers that have come out with negative messages against the vaccine to the point of anti-vaxxer messaging. And that too is so totally wrong. And this is, and this misleads the public when you have messages of this nature coming from a trusted profession. So in terms of the operational requirements of the workplace when it comes to healthcare workers, they have to take the vaccination. And if they don't take the vaccination, what else can they, it means loss of livelihood, basically. Very, very, very important. The employer can only go that route in terms of not, the employee not being able to give you that capacity in terms of the workplace if the processes have been put into place. And there is a direction that came out on the 11th of June, which made it necessary for workplaces to actually do a risk evaluation in the workplace, identify those that are in need of vaccinations for various reasons, and institute measures, including discussion with the employees. And I'm not, and I do believe that many employees in the private sector have gone ahead and done so. For example, we've seen the announcement about Discovery, making it mandatory in January. So they are taking their staff through the processes. Have our state institutions done anything like this? And if our state institutions haven't started, then the question is, why the lethargy? Why haven't they moved forward? It's the pandemic. It's not business as usual. The wheels cannot turn at snail's pace as usual. We in a relentless pandemic that doesn't seem to be settling. We have the president and the leadership coming out with messaging, but what exactly are they doing to ensure that state entities institute the measures to take that messaging forward and to operationalize the issues on the ground? The family meetings, I'm sorry, some of us have become tired. They just talk shops. Let us see action on the ground, please.
Yes, clearly, Matthew, and obviously action on the ground, as Professor Dhai mentioned. And the key issue here is the economy of the country. And the economy, prior to the pandemic had suffered. Basically, we were in a dire economic situation, and this has obviously made it worse. And the question is just how much longer can we sustain, what is happening, the devastation and the destruction of the economy going forward, if we don't do anything right now that will still, at some point in time, has got to instill confidence in the country. You mentioned things like restaurant and the travel industry. We're coming to the holiday season as well. And we know it's scary out there when we look at the hospitality industry and what is actually taking place. So at the end of the day, it's not about us in South Africa. It is how we are seen by the rest of the world, and whether they are confident enough to look at South Africa, so that, and our ability to do something in getting out, or providing at least relief to a point where there is confidence in the country once again.
No, exactly. I mean, I think there's many issues we have to cover at once. We can't afford to go for unemployment above 44%. That's already a ticking time bomb. I think we saw in the violence in KZN and Gauteng recently, and Livers had a political and criminal element behind it, but it fed into a sea of poverty, of unemployment, of despair, of hopelessness, etc. So we have to get it. I think we're fortunate that we got two critical tools within our disposal to help us emerge from the pandemic. One is the vaccine. It's been shown by scientists across the world to be very effective, to save lives, to enable the economy to re-emerge safely. I think we do need to be realistic that it's not a permanent vaccine like some other vaccinations are, which cover you for life. This one covers you, it seems to be about for 6 months at a high efficacy level. So I would assume, to be cautious, to be conservative, we'll need to vaccinate probably once every 6 months, once every 8 months for the next foreseeable future. But the positive part is that the vaccine is here. It's being produced locally as well, which also makes it a bit easier for us going forward. But of course, the other thing is we need to, even after you're vaccinated, we need to maintain the other health and safety measures because they all complement each other. The wearing of masks is it's a very least invasive protection mechanism. It's for free, etc. The social distancing, the sanitization, also critical as well. But most critically, the mask and the vaccine, those are critical tools to save lives, to save livelihoods. We can do all the other social economic interventions. We can provide unemployment insurance fund relief. We can provide tax relief, other forms of relief from the state to these parts of the economy. That's not sustainable. What is really sustainable is emerging safely so companies can open, so workers can go to work, etc. And the critical tools are that we all wear masks, observe the health and safety measures, but we all go out and vaccinate. There's no reason why those who have not vaccinated yet don't go and vaccinate tomorrow. It's an investment in your own body. It's like when you service your car, you're investing in your car. It's just like when you receive your other vaccines for cholera, for polio, for hepatitis, for measles, for mumps, etc. It's an investment in your body and your family's livelihoods because you can continue to work safely, etc. And those are easy things we can all do. Government doesn't need to do it. We just walk across the vaccine center, you register there, you're done in 20 minutes. It's quick, it's simple. So I think for us, that's really the critical thing. We must look at the other issues and we'll learn from them as we go along. But I think right now, as Professor Dhai is saying, this is an easy tool within our grasp. And I think she made a very good point to say, you have the right to decline a vaccination for whatever reasons you might choose. You have an individual right, but you must accept the responsibility of putting your family in danger, putting your friends and your colleagues in danger, and the possibly fatal consequence to it, sadly, to be very blunt with you. Because as you said, Inayat, we're going to likely go into a fourth wave November, December, and we're going to see a spike in deaths like we saw earlier. And there's going to be consequences, sadly, to it in terms of health and in terms of jobs as well.
Well, to you, Professor Dhai, and also Matthew, time obviously has run out, but I must say it's been an absolute pleasure having both of you as part of the panel discussion this evening, and I'm sure this is not going to end. There's still a lot more discussion that is going to take place going forward, and I think we barely scratched the surface tonight. But once again, we do appreciate you taking time out, and please be safe. Please take care of yourself. All the best to you.
Thank you.
Thank you.
Well, that brings us to the end of part one of the discussion this evening on Wednesday night with myself, Inayat Wadi, our COVID-19 vaccines passports way, and you can view this interview on our YouTube channel and also on our Facebook channel. We're going to go for a quick break, and we are now going to be focusing on political parties as they prepare for the local elections and reaching out to voters. But what we are seeing this time around is we are seeing many independent candidates, and we're going to see a lot of the smaller parties featuring very, very prominently. And when we come back, we'll be having an entirely different discussion looking at preparation towards the 2021 local government elections.